Good afternoon, everybody, and welcome to Tuesday, the 22nd of September's Health and Wellbeing Board. Welcome to everybody who is watching. If anybody is watching us online, welcome. And welcome to all my colleagues who I can see some of you, but not all of you. Strange times, really. So thank you all for taking the trouble to come today. It's much appreciated. We're going to start with some announcements, and the first one will be our apologies, please, Nikki.
Chairman, we've had apologies from councillors Burrows, Cawthorne, Mills and Saray Puddyfoot. We've had apologies from Lynn Hill, and Turkey is here as her substitute. We've had apologies from Dr. Hadjioff, and Sharon Day is here as his substitute. Robin Duran and Graham is here as her substitute. Thank you.
Thank you. Agenda item 2 are our declarations of interest in matters coming before this meeting. Are there any? If there are, please indicate.
Chairman, would it be okay if we did a roll call?
Of course, Nikki.
Would you like me to do it?
Yes, please.
Okay. I do apologise for interrupting. If I go through those members that I'm expecting, if you can confirm that you are actually here, please. Councillor Jonathan Bianco.
Present, Nikki.
Councillor Richard Lewis.
Present, Nikki.
Councillor Susan O'Brien.
Present.
Dr. Ian Goodman.
Present, Nikki.
Turkey Mahmood.
Present.
Tony Zaman.
Present, Nikki.
Sharon Day.
Present, Nikki.
Dan Kennedy.
Present, Nikki.
Graham Call. Graham.
Present, Nikki.
Thank you. Caroline Morrison.
Present, Nikki.
And Sarah Crowther. Okay, thank you very much. Thank you, Chairman.
Thank you, Nikki. Brings us on to agenda item 3, which are to approve the minutes of the meeting of the 24th of September, and they are pages 1 to 12 on your paperwork. If anyone has anything to say, please indicate. If nobody has anything to say, can we approve the minutes? And unless I or Nikki see anybody indicating otherwise, I'll give it a couple of minutes. Are we happy? That looks like we're happy. I think we'll approve those minutes. Thank you very much. Agenda item 4, I just want to confirm that the items of business marked part 1 will be considered in public, and that the items marked part 2 will be considered in private. Just before we go on to agenda item 5, you can see I haven't got my glasses on. It's a long time since we've met as a board, and certainly it's the first time we've met virtually, and I think it's the first time I've chaired a meeting virtually, so pressure on. Due to circumstances beyond our control and the COVID crisis, this is where we find ourselves. We've just experienced the most serious and challenging health issue of the generation. I want to ensure that we focus on what this has meant to the health and well-being of our population and how we've responded and what we need to do next. So the agenda's been set so that we can have a debate about the issues and to take stock of the partnership response and agree recovery actions and build resilience. We can pick up some of the issues that are ongoing on business as usual or at our next meeting in December. We've got significant changes afoot as part of the NHS long-term plan and moving towards a single WLCCG, the significant changes are going to impact on our work. So it's my hope as chairman that we can take this opportunity to reboot the board so that it works for all partners and provides Hillingdon with strong strategic leadership. I'll talk about that in part 2. But I need to take this opportunity to thank our health partners who are sitting, some of them I can see their faces, but I just want to thank you on behalf of all of our residents for all the work that you're doing to keep us safe from COVID in this time. So thank you. That brings us on to agenda item 5, the board membership update, page 13 to 16 on your papers. So what we're going to do there is to, there's some recommendations there that Mr. Jason Sees replaces Miss Sarah Tedford as the Hillingdon Hospital NHS Foundation Trust non-voting co-opted member. Are we all happy with that? Or that's just for recommendations. There's lots of nodding, smiling faces. Welcome, Jason. I can't see your smiling face at the moment, but I've already seen it very recently. So welcome, Jason.
Thank you.
Oh, there you are. And I really look forward to working with you. It's good times. So thank you very much for that. That brings us on to agenda item 6, which are pages 17 to 50, the COVID-19 local outbreak control plan update. I'm going to ask Dan to speak on the first part of it, and then I would welcome Caroline to present the North West London Summary Recovery Plan Appendix 2. So Dan, would you like to, kick off, please?
Thank you, Chairman. I should probably start just by echoing the words of the Chairman, really, that, I mean, from a health protection point of view, this has clearly been a very challenging time for the nation and the world. And as we respond to the COVID-19 panic, we certainly saw the earlier part of the year with significantly higher levels of infection from the virus, obviously with very tragic consequences. And then we saw a period where, following restrictions and as we understood the virus better, compliance with infection control measures and changes in actually everyday life, which helped to bring considerable reductions in infection rates. We are now seeing, however, evidence that the infection rates are rising again. And obviously we'll be hearing more from the Prime Minister later today about what new measures, if any, need to be put in place. But in terms of, I suppose, the infection rate in Hillingdon, it's generally speaking, on average, been less than the London average. But I think what's an important message for all of us is that whilst we're confident about some of the measures we've put in place, I guess none of us can be complacent about how quickly that can suddenly change. But let me turn to the local outbreak control plan. As part of the preparations that local authorities were required to put in place, working with partners, all of us had to put together what's known as a local outbreak control plan, which set out a range of measures, actions that can be taken to either prevent the spread of the virus or control it if it does start to evidence an outbreak. There are 7 key areas, and I won't go through them laboriously, but they include areas such as putting in place measures and arrangements that if there is an outbreak in a setting, there's a quick response, there's very clear measures. In London, we work closely with the Public Health England London office to respond and work with them to control any outbreaks. There's also a range of other measures that we've put in place, such as identifying what we might describe as higher risk locations where we can put in place effective arrangements to try to control or prevent that virus spreading. There's messages that we've provided to residents through media channels. There's arrangements that we've put in place working with Public Health England around testing regimes and additional testing in key locations, amongst others. The plan has been prepared with partners, and we're keeping it under very regular review. And just to illustrate some of the measures that we've put in place, so we've worked with schools, we've worked very closely with care providers through Tony's team. There's very, very prescribed guidelines that care providers need to follow, and we've been working with them to ensure that there is adherence to that. Through our environmental health officers, we've been proactive in visiting premises and providing advice and guidance to business owners about what they can do, what they should do, to ensure compliance. We've been undertaking unannounced visits to premises, hospitality sector at the weekend to check compliance. And more recently, as students return to university, a few of us from working with the CCG have been on calls with university leaders just to make sure that they've got everything in place that they need to, and if they need any extra help, then that's available to them. And certainly a call that Dr. Goodman and I were on recently with Brunel University, and we were reassured by the arrangements they have in place to do everything possible to support the students to comply. On a practical level as well, I should just say that through the CCG, there's a regular health and care partners meeting to ensure that we've got up-to-date information about the current picture on the ground, so to speak, across the health and care system. And that's helping us to ensure that we're coordinating effectively and sharing updates and taking the necessary action that we need to. So, I mean, that's a bit of a pen picture, Chairman, about what we're doing locally. I'm sure that the picture will continue to change, and we'll need to continue to respond fast and appropriately in line with government guidelines. But I think the message I'd want to give to the board is that we're ready to do that, and we're confident but not complacent.
Thank you. This was a delay when you have to try and find the on/off button of your microphone. Thank you very much. That's and then it's an excellent document, and it is an example of how well we are working with our partners. Caroline, did you want to say something now, please?
Yes, of course. So thank you, Chair. I mean, the other section to this paper was really included to give the board a bit of context around some of the North West London wide working. So there are two parts to it. One is the North West London out of hospital recovery plan, and the second part is then the Hillingdon specific actions. The background to this really was that as we started to come through wave one as a health and care partnership in North West London, we thought it would be a good time to take stock and really think about some of the priorities that we needed to get in place over the next 0 to 6 months. So that's the time frame for this really. It's not designed to be a long-term plan. It's about setting up primarily a safe and responsive sort of health and care recovery from the first wave of COVID. So one of the key principles around all of this very much is safety, making sure that when people do need care, it's delivered in a sort of safe and effective way, that we make sure that some of that, a lot of those digital and online ways of accessing care that we put in place as a response, mainly really to infection prevention control, to try and make sure that only people that really needed face-to-face care actually came to those health facilities, just to take stock and make sure that we'd done that sort of effectively and safely, whether we needed to do any other things to kind of mitigate any impact of that. And as you can see, it's split down really in terms of some of those sort of urgent care responses and then some of the planned care responses, because I think the other thing that we're really conscious of in the health service is that during wave one, obviously things stopped, and we need to have a mechanism and a plan in place to get those things going again. So there's been various levels of guidance issued to the NHS as a whole. And we're working now to a range of targets around getting our planned care activity back up as a system, and we've got a sort of a trajectory against that. And equally, sort of locally, we're needing to look again at that sort of urgent care response and ensure that we've got the the systems in place to make sure that people are able to access urgent care when they need it, but not necessarily face to face. And because what we really don't want going into winter is obviously crowded waiting rooms where people are experiencing respiratory symptoms and sort of struggling with that. So more and more we're also looking at that population base in the community and what we can do with primary care and with our out of hospital services to wrap around those communities. So page 9 is the specific Hillingdon part of that, and hopefully you'll be relieved to know that this is a summary. There's a sort of a 40-page document behind this, which I didn't think would bring to the board, but this really captures just the key headlines. So just to pick out a couple of bits in there, we've got some work around the what we've called hot hubs. So there are our escalated care clinics in Hillingdon to try and ensure that where people did have COVID symptoms in the community, they weren't managed in our main general practices, so that those general practices could still continue to see children for immunisations, see those proactive care patients going through. So we're continuing to look at how we make sure we've got an integrated response in the community for those COVID symptoms. And also looking really very much on our neighbourhood teams, so our primary care networks, which we cover in the next paper too. So I won't talk too much about that now, but ensuring that we've got our community mental health and primary care teams working proactively with people in the community, particularly to make sure that we've got care plans in place and that we're looking to manage any impact of long-term condition of people who may not be accessing primary care in the same way that they were previously, and particularly focusing on those areas of inequality. So that's a really whistle-stop tour of a lot of work, but very happy to take any questions on that.
I mean, it really is a good piece of work, and you know, I can't sing this praise highly enough. Just coming from another board where things weren't looking quite so well as they are here in partnership working. Does anybody have any questions, please? It's quite difficult for me to see who does, but maybe somebody. Please just take your mic off and ask if you have a question for Dan or Caroline. Can't believe no one is going to say anything here. How are we doing in care homes? Are we content that they're safe for our residents at this stage?
Sorry, Tony here, Chairman. The situation is, as you'd expect, quite changeable, and we're doing our best to work with North West London in terms of keeping on top of the repeat testing, and to be honest, it's really difficult to say in terms of, because as I say, because it does change one day to the next. However, I think the important thing to say is that all of the mechanisms around whatever the situation is are in place. So we've not been caught out. We're working with providers. They've got access to all the PPE and infection control that they need, and it's a challenge for the whole system to keep on top of the care homes. But along with North West London CCG, there's a robust plan in place. And as I say, but certainly as at this stage today, we have challenges beyond sort of COVID, as you're aware, with some of our care homes, which in fairness may be a result of that, i.e. in terms of their financial viability and willingness to carry on trading, etc. But that's a sort of separate point. So as we are, as of today, yes, we've seen an increase in the prevalence of positive tests in sort of care homes for residents and staff, but all of the infrastructure is in place to manage that.
Thank you, that's really useful. Dan, how are we doing on the schools? Are we anything needing to be looking at closure there, or are we doing fairly well?
Thank you, Chairman. We seem to be doing very well. All of our schools are open and available, and are open, I should say, for our residents, our children in the borough. We've spent, Tony's team and my team have spent quite some time working with schools prior to the end of the summer term to ensure that they were ready. to fully reopen for September. And so, for example, I know that every school has completed a risk assessment. We've provided advice and guidance to them, and as a local authority, we even provided what we called a starter pack for PPE as well, which was very welcome and warmly received by schools, and that they found that incredibly helpful. But we've had no reported issues. I mean, what we are seeing, which is completely understandable, is that some classes are having to self-isolate as a contained bubble because there's 1 or 2 children in that class who have developed symptoms and subsequently tested positive. So, but I think that unfortunately is going to be the nature of the business, so to speak, for at least the next year. But all schools, from my experience, seem to be managing very well.
That's lovely, thank you. I think my face might have suddenly disappeared off the screen for a while there. I can only apologise. Anybody else have any questions or comments for the report authors?
Madam Chairman, I'm new to this, so apologies if what I say is not sensible. But following on from what Dan has just said about schools, there seems to be a concern in the general public about the impact of the mums and dads collecting from schools as being a hotbed of potential infection. Are we working with schools to ensure that they socially space and all this sort of thing? Because as much as it is good to make sure the kids stay in their bubbles and or avoid and or are put in isolation if it looks as though there are cases where they could have come into contact, I would guess that the problem is probably even greater with the parents.
Thank you, Councillor Bianco. Yes, Dan, are you able to answer that?
Yes, and thank you, Councillor Bianco. We've worked with schools as a local authority, and we provide what we call distance markers outside schools in most schools. And school leaders have also regularly reminded the parent community to observe social distancing, and many have actually staggered collection times as well to try to prevent and reduce the likelihood of parents or carers gathering outside schools as well. So I guess I'm confident that schools are doing everything they possibly can, but it obviously never stops, and you have to keep sending out reminders and sending the messages out that we have to continue to be vigilant, and as the messages says, stay alert and continue to socially distance.
Thank you.
Thank you. Does that answer your question, Councillor Bianco?
Well, I think so. I mean, I think it's disappointing that parents don't seem to be able to remember to do that sort of thing without being constantly reminded. But that is the nature of the beast, I suspect. That
conversation is probably for another day, Councillor Bianco.
I think you're right.
Board. Does anybody else have any questions for the? Yes, Councillor Lewis.
Yes, I know it's probably slightly ahead of time, but are we making any plans for students coming back from universities? They're just going up now to university, but bringing COVID-19 back into the borough just before Christmas. And are we making any public announcements about they coming back, say 2 weeks before, so that they can isolate and quarantine themselves prior to Christmas and family celebrations?
Chairman, shall I? Yeah. Thank you, Councillor Lewis. We had that conversation with the university leadership teams when we spoke to them, and they were of the opinion that that the advice they're giving to students at the moment is consistent with government guidelines. In other words, we haven't had any guidelines about students returning home after their studies have ended, or for the semester term at Christmas time. So I think it's one to watch, and so I think we'll need to come back to it. So, for example, do we encourage students to get themselves tested? But again, that really depends upon whether or not they, at the stage of the virus, whether it will actually be detected. So I think it's one to watch, and we just need to continue to follow government guidelines and obviously continue to socially distance. But the students are staying in their household bubbles at this present time, and they're not getting within that 2 metre space in any seminars that they're attending. So that they are in a contained bubble as we speak.
Can I just ask, what do we feel as a community about the compliance with guidance? Are the experts, do we think that is something that's happening? Are the community complying with the guidelines and using PPE in venues? And what do we think about that as a board?
Well, Chairman, it seems to be very mixed, and it depends on the communities as well. Certain communities are much closer to family units and large family units, and they don't seem to, and certainly around here in the Ealing area, we have a very large contingent of Eastern Europeans who don't seem to perceive the British government to be their government and are totally ignoring the guidelines, it would appear.
Health colleague, does anybody have a view on that? Or Caroline, you hesitating? You're going to say something? Okay. If nobody has a view, that's fine. I just
Chairman, could I just it's Dan here. Could I just add that what we've sought to do is to really get some messages out there into our communities through faith leaders and community networks. We've got about 150 contacts through communities, through our community networks. So working with the council's communications team and other partners, we're seeking to deliver that message, but not just in ways through written form, but also through sort of verbal delivery as well, so that we're passing messages on to those faith leaders who then pass them on to their communities. But I certainly don't pretend for one moment that we've got that position completely resolved, and it's something that we'll need to continue to work with and continue to remind communities about the need to observe government guidelines.
Thank you. And yeah, sorry, I've interrupted somebody.
Sorry, it's Ian Goodman here.
Oh, sorry.
Yeah, so I just want to raise the issue of the flu vaccination campaign as part of this health protection. So that's already started amongst pharmacists and amongst GPs, and it's being ramped up. I think it remains to be seen what the uptake is going to be, although I suspect it'll be higher than it has been in previous years. There's some evidence that came out recently that if you have flu and you get COVID, then your risk of complications are doubled. So it's increasingly important that we vaccinate as many people as we can, not just the vulnerable ones, but the over 50s if we can. I think there are some good communication systems in place to allow the transfer of information about who's been vaccinated between the pharmacists and the GPs. The GPs are probably the main source of truth about in terms of who's been vaccinated, and that data is collected in Northwest London by the Whole Systems Integrated Care Dashboard, and it's published for access. The issue is people are vaccinated elsewhere, particularly children at schools. And I suppose this is to Graham, that we need a system so that GPs can reliably be informed of who's been vaccinated at schools, so they can update their records, which can then feed the dashboard that's being used across Northwest London.
Thank you, Dr. Goodman. That's really useful. The meeting I was at this morning, this came up across the Health and Wellbeing Board chairs, that we're being encouraged to encourage our residents to have a flu vaccine, and I'm glad you mentioned 50. That that was something that was also being talked about. We must, as a borough, ensure that our residents are getting flu vaccines. And also you've mentioned the recording. That was another thing. People using different recording systems is making things quite difficult to find out who has had COVID into the and going back into the community. So that is perhaps something maybe we'll be looking at as a board a bit later on. Councillor O'Brien.
Thank you. And yeah, that makes sense what Dr. Goodman is saying. Maybe I could invite Dan and his team to possibly get a message out to our schools for us to be able to get that message back so that we're getting the correct information, if that's possible. That would make perfect sense for Hillingdon, I think.
Yep.
Thank you. Are we all happy with that, unless anybody's got anything else to say?
Well, I was just going to say, Chairman, that the government has backed up that idea of it being vital for over 50s to be vaccinated by reducing the age for the free testing, for the free vaccinations down to 50.
Yeah,
so
thank you.
That's been quite helpful.
Thank you, Lou. Okay, thank you very much, everybody. That takes us on to agenda item 7. Pages 51 to 58 on your paperwork. Caroline, I'm going to invite you to present this, if you wouldn't mind. Thank you.
Yes, of course, Chair. Thank you. So the paper that we've brought together, although it has come, and I'm presenting it from CCG, it really sets out, I think, a lot of the system-wide working that we've been doing in Hillingdon, and puts the context really around how some of the reforms that are happening at North West London level will impact on us locally in the Borough of Hillingdon. So some people may remember back to the start of 2019, it seems like a long time ago now, when the NHS long-term plan was published. And within that, there was a future direction set for health and care governance, but particularly focusing on the NHS. So it started to look at sort of 3 population levels and structures to support that around healthcare planning and delivery. One is an integrated care system, which in our context is North West London wide, and covers both the sort of current commissioner and provider organisations alongside our local authority partners. One is a sort of an integrated care partnership or place-based model. So for us, that really centres around Hillingdon. And the third element is a neighbourhood level. So in Hillingdon, we have 6 neighbourhoods, which are built around groups of practices working together, primary care networks, which are whilst they are founded around the GP practices, are actually much more than that, and incorporate our community services, our community mental health services, and increasingly our links into social care as well. So that is a really important focus for us in Hillingdon. So just to update a bit on where we are in North West London, to support that integrated care system working, whereas we currently have 8 clinical commissioning groups at the moment, of which Hillingdon CCG is clearly one, we have been working over the last 18 months really to move towards the delivery of a single clinical commissioning group, so that we've got strategic alignment between how we're commissioning services across the whole area of North West London. And just as a quick update on that, which we couldn't put into the paper, we had a vote of the practice membership. So clinical commissioning groups are member organisations, and the practices are those members. So any change that we make to the constitution or to the makeup of the CCGs has to go via a vote. So across the 8 CCGs, we all voted week commencing the 7th of September. And in Hillingdon, the vote was in support of moving towards a single CCG, as it was in 7 of the 8 CCGs. So I'll come back to that. I'm sure there'll be questions about that, so I won't preempt that. But 7 CCGs in North West London supported the move towards a single CCG. So there's some next steps around that, and we have a governing body meeting tomorrow also to kind of talk that through and the implications of that. So whilst the actual kind of statutory CCG process is moving to a North West London level, what's really important is what sits at a borough level going forwards. So from a commissioning perspective, the proposal is that we have a borough committee that is retained in each of the boroughs, and it involves GP membership sort of continuing, as well as the Director of Public Health, lay member representatives. So similar to the sort of constituted makeup of the current CCG, but smaller in terms of numbers. And that would be a subcommittee of the CCG, a formal subcommittee, able to make sort of some local decisions. It would probably be fair to say that the detail of that delegated authority is still to be worked through, but it's certainly there in the Constitution. But that is really to make sure we retain some local accountability. On the system side in Hillingdon, and where we are, I think it's probably fair to say, ahead of the game in Northwest London, is the development of the integrated care partnership working. So that's where our provider colleagues are working together, and there are sort of many people involved on the call today. So obviously Hillingdon Hospital, CNWL, H4All, which is our third sector organisation, and the Primary Care Confederation, which is the organisation that represents all bar 2 of our practices in Hillingdon, all work together through a formal alliance, what we call an alliance agreement, which makes them jointly accountable for the delivery of services and for improving care in Hillingdon. And it just takes out a layer of kind of transactional working and fragmentation between all of the services, which we found, particularly during COVID, meant that we had a really, really strong foundation for some of that partnership working. So just moving forward in terms of the Health and Care Partnership Board, I'd say we're probably one of the only sort of formally constituted ICPs in Northwest London, which gives us, I suppose, both the kind of opportunity and curse of being the area that everyone's looking to try and sort of move forward and set a bit of a precedent. We have, in the last sort of month or so, made some sort of specific agreements around what the I suppose more functional elements of that might look like. So we already have a health and care delivery board across the partners, where the system comes together to look at the way that we deliver care locally. So a lot of our urgent and emergency care reports into those groups already. A lot of the work that we've been doing around schemes such as discharge to assess, where we've been looking at how we integrate the discharge process from the hospital across health and social care reports into there, and more a lot of the proactive work that we're doing with our kind of population and our, as I was talking earlier, our neighbourhood teams is going to be reporting into that board as well. So we're really trying to increase the sort of visibility of all of the schemes in Hillingdon through that partnership board, and support that function locally. The only other thing I was just going to mention was that some of the specific decisions that have been made over the last couple of months really is that there is a level, although we're always very good at organisational structures and we always talk about, form following function, you do get to a point where you do need a bit of a kind of structure around things. So what has been agreed amongst partners is that from a provider perspective, CNWL are going to be the lead organisation for that. So what that doesn't have a contractual element in as much as that doesn't talk to some of our commissioning arrangements, but it means that CNWL have agreed to host the function really for some of that integration work, including the appointing of a senior manager and some of the integrator teams who in previous sort of existence would probably be doing some of the work that the CCG teams are doing. But as we go through that consultation to move to a single CCG, some of those functions will look a bit different, and we need somewhere to land them in Hillingdon really safely, because we've got very good people and good relationships that we really need to preserve and keep the momentum going. So we will continue to use the Health and Care Delivery Board really as the vehicle for executive decisions, and as I say, strengthen some of the governance around that. And we've got local authority members on there sort of as observers at the moment, but obviously in time it would be great if we could kind of progress that to a kind of a more formal role within that. And really, I think going into winter, that group is going to be really key as we start to, across the system, manage around both the sort of potential for a wave 2, but then also the winter pressures that we will all be encountering in a slightly different context to how we've done previously. So that's sort of quite a lot of work bundled into one paper. It really picks up the kind of strategic stuff around the direction of travel for the NHS, a bit around what that looks like at Northwest London level, and then really some of the transformation work that we are doing and the governance around that in Hillingdon. But really happy. I don't know whether any of the other sort of provider partners on the call might want to sort of chip in from their perspective potentially as well, but happy to take any questions, obviously.
I was going to ask Tony to, because we fed in to that consultation process, but before I ask Tony to do that, does anybody have any questions or want to make some comments on what Caroline has said?
Chair, it's Graham from CNWF.
Please do.
I think Caroline has presented that incredibly well, and it's a really good summation of the journey we've been on for actually quite some time with Hillingdon Health and Care Partners. I think we worked out it was 2013 when this journey started, so it feels a bit of a key moment in our development now to where we've got to in terms of really formalising the governance and how we're driving that integration engine, for want of a better term, to move us to the next level. So it's a really exciting time, and we're clearly very excited to be supporting partners and how to move HHCP on to that next stage in our journey. I just commend everything that Caroline said. She presented incredibly well.
She did indeed, as always, Caroline. Very, very good. Just for the board's information, I've also joined the NWLICS meeting with local authority leaders. It's essential that for me that I'm there to ensure that we hear the voice of Hillingdon and what we want. We need to keep. We're good at what we do here, working with our health partners, and I personally. And I know our officers don't want that to be lost within. Tony, do you want to talk a little bit about, we've fed into the consultation. Do you want to have some conversation with that now, please?
Sure, thank you, Chairman. As always, I always feel a little bit like Eeyore coming in here with the less bouncy sort of approach to it. But just to put some context around that, around that preface, we've worked really well as a system, certainly all of the time that I've been here, and a lot of the progress that we've made that Caroline describes is absolutely right. Local authority has been a part of that in terms of aligning some of the services that we have in order to make sure that residents are getting the full benefit. As you suspect, there is a but coming, and that really is, I think, a separation of the two things. So that's about the development of the integrated system locally, and as I say, at that level, I think we're doing really well, and we are ahead of the game. And I think the rest of the system will increasingly learn from some of the things that we've done in Hillingdon. The whole merger of the CCGs, I think, gets conveniently sort of nudged into the same discussion about this, but I think they're different and separate, and we've fed that in the consultation, where because we've had such good relationships with certainly our local CCG. And given everybody's praised Caroline for the brilliance of her presentation of the report, I'll commend Caroline on her brilliance as probably the best managing director that I've worked with in CCGs in the 3, 4, or 5 that I've worked with in my time. And so we do some really good work. And I think one of the things that we've put into the consultation feedback is that we fear that some of that will be lost because of the drawing together of decision making over some of the decisions, not all of them, into Northwest London, and for us that makes little sense because of the level of congruence that there is in the Hillingdon system. So unlike lots of other, in fact, unlike all of the other boroughs in Northwest London, we have over 80% of all our activity is about one hospital, one community health provider, one local authority, and one GP sort of federation as it is now. So we're a very tight system with very little overlap, whereas a lot of the other areas have quite complicated relationships between different health providers and different hospitals, etc. So we fed in most strongly and can see no justification for the reason of not leaving Hillingdon to be a lot more standalone, other than the fact that I don't think we can escape that one of the exercises by the NHS is to save money in terms of the overall management. I wouldn't expect other NHS colleagues to comment on that. That's sort of, that's our view. And so there is, as I say, I think they're separate and distinct issues, and we've been quite strong in our opinion about the merger of the CCG. I think the other point about that Caroline and Graham mentioned about the local authority becoming more of a confirmed partner in the local arrangements is again linked to the bigger issue that across Northwest London the health system is something to the tune of 200 million in deficit, and of course, well, not of course, but I obviously discussed it with my then sort of cabinet member and the leader of the council, and it's the view that until we see some way as to how that sort of financial gap is going to be addressed, it puts at peril some of the services that we would be sort of putting into the mix if we were to be a more formal member of that arrangement. So, but again, just to end on a positive, that doesn't mean that we don't get involved and we don't play ball. Absolutely, we do. We're involved in a lot of, well, all of the decision making, albeit at sort of different levels of engagement because of needing to be a formal member of various boards or not. We align all of our activity in order that there is the maximum benefit for residents, patients, whichever side of the fence we're on. And to some degree, really, the missing part, I'd like to say, is more of a formality rather than a kind of deficit in what we're able to do, because we are doing some really increasingly sort of smart work here. And we'll see later on in the Better Care Fund presentation by Gary that lots of that is captured within the Better Care Fund. So I'll leave it there if that's okay, Chairman.
It's very okay, Tony. Thank you. And I think it's more. What did you align yourself? It's more. Are you more of a Tigger than an Eel? But, thank you very much. Is there anything anybody else wants to say on what's been given, the presentation there by Caroline and Tony's additions? Councillor O'Brien, and then Graham, please.
Thank you, Chairman. I would just say that my surprise when I read this about the 8 merging CCGs, I'm feeling probably a little bit Eeyore or Tiggerish as well, but it will be a watch this space because I'm new to the Health and Wellbeing Board. You know, I think as Tony said, we have to embrace it and move along with it, but slight trepidation, I think.
Graham.
Thanks, Chair. If I could just respond specifically to Tony's point on membership, because I completely appreciate the position of the local authority, and certainly I wouldn't want to be signing up to absorbing a 200 million deficit if that's the scale of the figures we're talking about. But just to clarify, we recognise those concerns in HHCP, and as a result are suggesting the creation of an associate membership status, because we would really welcome the local authority having a seat round the table and being an active part in our decision-making process without any of the risk coming alongside some of the key partners in the delivery, but actually being part of the decision-making would be really valuable. So I would really encourage you to have some conversations with leadership and see if we can progress that. Thank you.
That sounds very positive, Graham. Thank you for that. Does anybody else have any comments? Otherwise, I'm going to suggest that the board supports the government structure as set out within the HHCP Health and Care Delivery Board, and we endorse what's written in the report. I think it's excellent, and I think we are, as I keep saying today, only because I've been to so many meetings today where it's not so well joined up between the councils and the health board. We're doing some really good work here. So, are we happy that we support and endorse the recommendations within this report? Fabulous. which now brings us on to, if I do my numbers correctly, I think we're on agenda item 8, pages 59 to 66 on your paperwork. Excuse me while I flick over. I think is that Kevin presenting that?
It can be, Chair. Very happy to. Yes.
Thank you, Kevin. There you are. Would you present it? I'd be very grateful.
Okay. Well, good afternoon, everybody. The paper at agenda item 8 from page 59 through to 66 is an update really on where we are with our joint health and wellbeing strategy, the joint strategic needs assessment, and our priorities for our public health functions. So if I deal with each of those in turn, the health and wellbeing strategy was agreed by this board back in 2018 and has its origins in the North West London Sustainability and Transformation Plan, which I think was 2016. So it's a bit dated. So we've decided for this board not to bring an update of that particular strategy, but to point forwards towards the fact that at this stage in the cycle, we would be looking to take a steer on how we will develop the next iteration of the joint health and wellbeing strategy from 2021, with the proposal that we come back to the next board with an outline as to how we might do that. And I think that would be relevant to the conversation we may have later in part 2 as well. There are, of course, in support of that, a number of building blocks of evidence and plans that are in development, many of which we've heard about already and we're about to come on to, in terms of the local outbreak control plan, HHCP delivery plan, plans at the hospital, Better Care Fund, and the joint strategic needs assessment. All of that is sort of in the mix, I think, at this stage for us to work towards developing a new joint and health and wellbeing strategy that reflects, as you said yourself, Chairman, a rebooted Health and Wellbeing Board through to next year. Shall I pause there and see if there's any comeback on any comments on the Health and Wellbeing strategy element of the paper?
Are there any comments? If they're not, do you want to plough on?
I'll crack on, shall I? And you can perhaps come back to me at the end if you wish to. So, and the next element is our work on the joint strategic needs assessment, which is one of the functions that we are expected to deliver in conjunction with the CCG and health partners around providing the board with a good evidence base really behind the strategy. There is at Appendix 1 to this paper an outline of the outcomes as they impact on Hillingdon residents and how they score really in relation to the rest of London and the rest of England. And as you might expect, some of the areas are good. Life expectancy for men is higher than England and London averages, and mortality rate is generally lower, as is infant mortality. I don't propose to go through the full list, but you'll also see that there are some areas where we would want to do better. So mortality from cardiovascular disease, cancer diagnosis at an early stage, physical activity of adults, and TB incidence, as well as child obesity and child healthy weight. So those issues are there in the joint strategic needs assessment. We've got the evidence base behind it. On each of those issues, we can drill down into more robust data sets to get a better understanding of some of those. And that's the evidence that we share with commissioners to try and support that commissioning process when we come to review new services. But that's where we are with the joint strategic needs assessment. We have in the council taken that set of data, that library of data, if you like, to help us in reviewing where we are with our public health priorities. And we have in the paper a set of 10 papers, 10 priorities rather, that we have concluded are necessary to take forward on behalf of the population, against which we will be developing. Some relate to contracts, some relate to services that are embedded in the council, some relate to services in which we work very closely with partners on, almost all of them do in fact. So those priorities will be part of what is basically our public health action plan now as part of the further year. What I probably should say in all of this is some of this data, as you see, is dated. It's about a year old now, so it's pre-COVID. We will be taking into account any emerging data sets that we get and any further evidence. I think the set of priorities are robust enough to reflect the fact that obesity is a contributing factor, diabetes is important, etc. That's all within the priorities that we've set for our public health function. So
Yeah, that's basically the summary of the report. Happy to take any questions.
Are there any questions? Caroline?
Yeah, sorry, it's not really a question so much as just a thought in terms of, I think the way that we use this data is going to be really important, and we've got the access to something in Hillingdon Whole Systems data set, which links together a lot of health and social care data. And I think one of the challenges we often have with these pieces of work is because they are sort of by nature large population-based bits of work, the measure of success becomes quite large and quite difficult to kind of quantify and tangibly track against. So just thinking in terms of, as we start to think about sort of planning for next year, not, only halfway through this year at the moment, but it would be really helpful, I think, to just sit down and pick through some of these indicators and maybe put out a few specifics that we could then maybe look to get some slightly more real-time information against, because you're often here working on some of the public health data on something that's 2 or even 3 years out of date, and it doesn't necessarily give you that sort of granularity. So and I'm sure this is sort of part of the next bit of work anyway, but I suppose it's an offer to kind of sit down and think about what some of the data indicators might be that we could maybe as a system start to work through, and then linking back to the previous conversation as well, through the integration working, make sure that we're lining all of those up in the same way we did with the BCF work and the kind of HHCP working. So that was all I was going to say, really. That's helpful.
Thank you. And I suppose it just makes me remember a conversation I had with you a while ago, Caroline, about domestic abuse. What I'd like to talk about on this board is domestic abuse. It comes under my remit, and I would like to, because while we've got health professionals in front of me, it would be remiss of me if I didn't mention the thing which is dear to my heart, and you are, seeing people with this disgraceful crime, and COVID is bringing such difficulties around people's mental health. I think all of us at some time are struggling with our mental health, and so I think these are difficult times, and I want to keep this board being open and honest in what we're seeing, in order to have properly commissioned services and make sure that we all are doing the absolute best we can. Thank you, Kevin, for that report. Are there any other comments? Otherwise,
if I could, Chair, sorry.
Of course,
okay.
Yeah, of course. Please do.
Yeah, just a comment around the child health indicators and the priorities. I mean, my experience of having worked in education for many years and had responsibility for developing areas of health education and physical education, I think what's missing in a lot of these plans is how you engage the parents in terms of developing their understanding about healthy diets. I mean, most of us, we tended to go for, the annual physical activity stuff to get children engaged, but that's not continuous, and it's not life-changing in terms of life-changing practices for individuals. I think it may be for youngsters who are keen and who are maybe at the more able end of the spectrum, but not for others. And I think there needs to be a real focus on how do you engage children who might not have the physical abilities, but still get them engaged in some sort of physical activity. And I just think that there's some work that needs to be done around that.
Thank you, Turco. Does anybody want to? I mean, I know we try here in Hillingdon to encourage our young people to do sport, eat healthily, but it is very, very difficult. Is there anybody who wants to make a professional comment on what Turco has raised? Kevin, thank you.
I was all ready to go until you said professional, and I thought maybe that's not me.
Oh, come on, come on. You're amongst friends.
I always worry about being called an expert. I was head of policy, which means I knew everything. I mean, that I agree with you entirely, Turkey, and certainly when we've looked at the whole issue of child healthy weight, the whole issue of nutrition, I think we had a bit of a gap in the borough in terms of what the provision was. We had permission from the leader to use some of our public health budget to work with a local school to develop a programme that we had ambitions of being able to roll out across the borough. Unfortunately, because of COVID, we had to put that on hold, but we are hoping to be able to resurrect that shortly, which will involve an element of cooking, basically, with families, and involve while the stuff's in the oven, they'll go out in the playground and do some physical activity. But the programme, which we call the Smile Project with Colin Manor Primary School, it's really quite exciting. I'm quite happily share with you details of that offline if you like. But if we can get that to work, then I think that has some opportunity for us to be able to start to make a bit of an inroad in this. It's an intractable area, and it's one that I think we do want to set as a priority, and to try and make some inroads in.
Lovely, thank you. Are we ready to agree the recommendations within the report that we've all seen? That's lovely. Then those recommendations, which begin on page 59, are agreed. Thank you very much, Kevin. We are now going to move on to agenda item 9. That is the Hillingdon Hospitals Foundation Trust update. Jason, it's your moment.
Hello. It's going to be such a downfall after Caroline's praises earlier, but I shall hopefully get close. So in the paper's a paper just updating on all the main developments at Hillingdon Hospitals. If I just take through the committee on the main headlines, if we just start with the trust board, Sarah Tedford, as you all know from previously working with her, she left last month, and hence me being here today, I'm covering the role currently. The other piece that's not in the paper, but just to bring all the committee up to speed as well, is our medical director, Dr. Kathy Kale, will also be leaving in October. She's got a new job, and we are just in the process of finalising arrangements around that role going forward as well. But I just wanted to bring that to people's attention. The other piece that we've just highlighted in the paper is we've gone through probably a piece around our objective setting. So every member of the trust has a personal development review on an annual basis. That process was slightly delayed with the COVID, certainly in the first half of the year. So we are just at the moment undertaking everybody's personal development reviews, and that's very much reference to the Trust's 6 objectives. The next key point highlighted in the paper is for the NHS, the main regulator of quality is the Care Quality Commission, the CQC. We had an unannounced inspection from the CQC in August over a couple of days. The result of that, in technical speak, is something called a Section 31 notice. In layman speak, that means that what they found is serious concerns, and in effect, we were required to take immediate action on a number of points. What I've highlighted there is the 5 key areas that over the last few weeks we've been taking a number of actions on. So one was around health and safety and the general environment, be it signage or flow around the hospital. The piece about fit mask testing. So as you wander around the hospital, people wear general masks, but obviously in more high risk areas about what masks people are wearing and that they're correctly fitting. The third piece was about environmental risk assessments. So for a hospital of our size, we probably have about 62 clinical areas, and to really make sure that all the risk assessments are sort of covering all the key risks that need to be managed. There was a piece on the Infection Prevention Control Action Plan and how we also administer some of our educational facilities. This is in the context of the formal CQC report will be most likely published mid-October. So what I'm reporting to you today is very much my opinion and how we've taken forward, and the formal report will be published in October. There's another piece we've just highlighted around our COVID planning, just picking up on what everybody said earlier. I think how everybody sort of throughout the pandemic has worked so much more closely together as a system. So yes, we had a lot of probably joint committees and systems in place, but boy, oh boy, what's that actually resulted in over the last few months about how we've done joint delivery, I think has really shown Hillingdon to be one of the sort of key sort of beacons of London about how a system works together. That is very much in place. As again, just linking with all of the news and what was said earlier, everybody's very much again working about COVID in terms of the second wave, making sure we've learned the lessons from the first wave and making sure we have those plans in place, because obviously there's announcements on the television later, but all the public health guidance when it's reflected against other countries is indicating that in a few more months we need to be braced just in case the number of cases continue to rise. There's a workforce piece that we briefly highlighted. There's an Nhs Staff Survey which is out at the moment, and again we will keep people appraised of the findings of the latest workforce summary here. On the money, to sort of simplify, probably in the first half of the sort of NHS cycle, so this current financial year of sort of 1st of April to 31st of March, the first 6 months, the money has almost been a secondary agenda, but it's almost to be highlighted going forward that I think there will be again a much more of an emphasis in the NHS about ensuring that we're really sort of driving all our efficiencies. And that's a process that we are sort of embarking to make sure we've got plans in place for the second half of the year. The end of the report just again is the partnership working, and a big almost thank you again to everybody. I think it's well documented in other committees and other discussions that it could be seen that the new Hillingdon Hospital for a few decades probably wasn't progressing that fast. I think how we've all worked together as a system over the last year and a half has pretty much positioned the new Hillingdon Hospital as one of the forerunners in the country, very much with probably one of the most ambitious build programs for the to be completed by 2025. So what we've highlighted in the paper is the piece around the strategic outline case. So it's a three-stage process, a strategic outline case which has gone in, an outline business case which will be going into the centre and the Treasury in spring 2021, and a full business case spring summer 2022, with the build then starting in 2002 with a finish date of 2025. So that's all very much progressing. And then for people who have obviously been around the hospital recently, there's some much needed short-term modular builds going on up at the moment, which will, just going back to the COVID planning, ensure that we sort of have some real fit for purpose critical care facilities from December, some decamp facilities, and again, our respiratory patients will have much better facilities when that ward opens. So that's very much a whiz through the key headlines, Chair. And if I pause there for questions.
Thank you, Jason. You and I have had one meeting so far, and you've certainly hit the ground running. And I in that short meeting, I could hear quite clearly how things have begun to go on the path that we would all welcome. And I wish you and your colleagues all the best for that path, particularly under the difficult times of a second wave. But I was absolutely convinced that things had begun to turn around, and that came across to me very, very quickly, and that needs to be said in an open forum. I know Councillor O'Brien has a question for you, or a comment at least.
I do have a question, actually. So under this section 31 notice, are you going to be, are you expecting to be inspected again? And if so, what? Following on from 4 weeks or a month into the immediate improvements, and are there any areas that are actually still outstanding over those 5 areas that you were tasked over? And which ones have you so far done really well?
Thank you. So I think the key piece for, if I answer it in stages, if that's all right, of how the Care Quality Commission will work is, I think we will have a sort of a number of sort of follow-up inspections. My expectations before that is sort of, again, working with partners and very much sort of experts externally. The challenge that we are putting sort of across our staff at the moment is actually that the best thing we can do is set our standards higher than the CQC's. So the key piece for us is to, on one level, self-police ourselves to make sure that day in, day out across 7 days that we are delivering to all the sort of standards that are expected by patients. The second piece is using all the colleagues that I can see at the moment as critical friends to come in and really test what we're saying as well. And so then hopefully to sort of provide you some half assurance when the CQC then come back, that we really know that we've got our house in order and that we're delivering against all the areas we need to. In terms of the question about the key areas that they've highlighted and how progress has been, the challenge very much in terms of context was they came in on the 4th or 5th of August. And pretty much probably by the end of August, for those 5 areas, I had to provide quite a lot of feedback on progress and assurance that we were really putting our house in order. Absolutely, I can say to you now at this stage in September, yes, we've made real progress against all 5. What I will counter though, and the challenge that we're still instilling, is we then have to become systematic with it. So there has been a huge personal effort across so many of the disciplines and so many of the staff. The risk is with all these things you slip back, and that's the piece that we need to become systematic now going forward across those areas. So that's the key piece there. Is that, would you like me to say anything else, or?
No, I think that's I'm happy with that for the moment. It was at the beginning of August. We're now nearing the end of September, and I think, as you say, it's education, and regardless of what type of workplace setting that you're in, we do become very familiar with our areas. And however, as a possible client of yours, I would like to feel reassured that that things have worked fast.
Councillor, Madam Chairman, may I say a couple of words?
You may, Councillor.
I have been waving, but you haven't been looking.
Sorry.
That's all right.
I can only apologise.
A couple of things I'd like to pick up on with you, Jason. clearly, the receipt of a Section 31 notice is a bit of a damning indictment, and I share Councillor O'Brien's concerns, as indeed I'm sure all the councillors on this side of this committee concerns, where our residents are concerned that the areas as fundamental as this have been slipped to the degree they have. I'm glad to hear that at long last, perhaps, these things are going back in the right direction, and I share with them their concerns that were we to be unfortunate enough, perhaps is the right word, I don't know, to land up in Hillingdon Hospital, that we would be properly looked after. I just wanted to touch, however, on something else, which was also of enormous concern to the council. And I particularly say this with one of my other hats on, which is as cabinet member for, amongst other things, property matters. And that is the proposals you have for the rebuilding of Hillingdon Hospital. Now, clearly, it's a good thing that the member for Uxbridge, as influential as he is, that has made sure that Hillingdon Hospital has gone to the top of the list in terms of being replaced. And that is good news for all of us, residents included. The council has very significant concerns remaining about the positioning, development, whole process of this new hospital, how you're going to manage to operate while you propose to build it. And because there are a lot of facilities that will have to be moved or go or something like that in order to accommodate the space, and whether you'll ever get a scheme forward that will gain planning consent, because there are very significant issues around that area. So we all welcome the provision of a new hospital. It's long overdue. Hillingdon Hospital is, as a building, or series of buildings, is well past its sell-by date. You've got no criticism from us in that field at all. But we have very significant concerns going forward that remain. And I hope that this is probably not the forum, but I hope that we will overcome those. I don't wish to appear negative, but I do want to put on record our concerns and the caution with which we approach that. Thank you, Madam Chairman.
So just to, if it's okay, just half assure the committee on that. Absolutely, if we just reflect on the process where we are and where and what happens next. In terms of that, so when you build new hospitals in the NHS, there is something called the Treasury Green Book, which is almost, it's been sort of, you have to follow due process all the way through. Otherwise, to sort of cut thousands of pages short, when you get to the end, you don't get to the check. You don't get the check. So with that, it's very much a strategic outline case, an outline business case, and a full business case. Absolutely, as you've just raised, crucial when we now going forward to develop the outline business case, that we work in partnership with the planners and all of our local residents about how we then take forward the preferred way forward of a rebuild on the current site. The key bit with that is, I know in other forums where we've sort of touched on examples or previous experiences about how we've done that in other places. I think that strategic outline case has been quite a high discussion. What I'd welcome at the outline business case is that for us to be doing very much open book with everybody on actually this is how it would work in practice. And that's the piece that we need to absolutely assure all partners at outline business case stage, how the hospital stays operational whilst we're rebuilding on the current site. And equally on your second piece around that actually environmentally, that the new hospital is absolutely to everybody's liking in terms of the local environment.
Can I come back in there briefly? Sorry, Chairman. Just to say, I mean, clearly the new hospital has been given the go-ahead not only by the Prime Minister but by the Secretary of State for Health in clear and unequivocal terms. I suppose we're concerned that the machinations of the NHS system, where generally you have to make a case for a new hospital, which is what you're talking about, an outline case, and then I question whether they're needed in this case, because you've already been given the green light. You haven't got to make the case, please, can we have a new hospital for this reason, that reason, and the other reason. They've already said, yes, you know, that box is ticked. I am concerned about the time it will take to get going. I hear what you say. I hope we can overcome some of these issues. And I hope we can do it speedily, because we do need this hospital to be built. I think 2025 is ambitious, frankly, knowing how the various parties work. And I hope I'm still alive when it's open and ready for use. But I do think that if we're going to get near to that 2025, we're only going to do it by getting a move on. And I don't mean by cutting corners, but by not doing anything that's unnecessary to get there. Thank you, Chair. I'm sure there is another forum for this, and I'd be interested to hear it. Thank you.
Finally, on this, if I could just say, Jason, that we would also hope that the public are engaged in the process, so that we're not having to, as an authority, backtrack and explain to them. You know, we would hope that there'd be full engagement all the way along the line, so that the questions can be asked as they go. And I'm sure that's part of our mutual work. So are there any other comments on this particular agenda item? Or are we comfortable enough to be able to move on to agenda? That's a thumbs up, so, Councillor O'Brien. I thought that was another question. In which case, if I don't see... Did you want to speak, Jason?
So, yeah, the other bit is, and I know this is my first meeting, and I'm going to sort of ask for forgiveness if it's okay. If it's all right, would it be okay if I leave the meeting at 4:15 because I need to go and get ready for the annual members meeting?
Absolutely. This isn't about binding people. You have jobs to do. Please, it's nice to see you. Thank you for your attendance. Please, anybody who feels they have to go, I'm not sure Nikki will advise me about the quorum side of it, but if it's suddenly only me sitting here on the screen, we're in trouble. Yes, Jason, thank you. Can we go on to agenda item 10, which is page 71, and that's the Better Care Fund. I think that's Gary, if you are around. Would you like to introduce that?
Good afternoon, Chairman. Thank you very much. Unfortunately, my camera is not cooperating, so you'll be able to hear me, but not see me.
We can. I can see you, Gary.
Oh, thank you. Good afternoon. Just by way of introduction, for board members not familiar with the BCF, to say its purpose is to provide a legal framework for integration between health and social care. Locally, it's seen as a mechanism for delivering aspects of the health and wellbeing strategy that we discussed, the board discussed earlier, dependent on integration between health and social care and closer working between the NHS and the council for delivery. When it was first introduced, the first plan was 2015-16. The focus was on older people, but the scope has expanded over time to include, for example, people with learning disabilities and aspects of support for children and young people, and that's really where we are now. What the board is being asked to do is agree an outline plan for 2021. Developed within the context of the pandemic and our current understanding of the likely national requirements for the 2020 BCF, and also taking into consideration the strong likelihood that when the requirements are actually published, we will have a short turnaround time to submit. And incidentally, my understanding is now from recent discussions that we're likely to see the requirements published in the first half of October. There are a few points that I just wanted to highlight for the board's attention. The report does identify some examples of joint working by partners and how this has actually supported residents and the local health and care system during the challenging times over the last few months. I think another important example to highlight, I think, is the joint work in support of the care market, which is quite a fundamental part of the BCF. and some of this has been touched on earlier, for example, around testing, provision of personal preventative equipment, infection prevention and control measures, and also financial support. And I think the board may be interested to know that feedback that we've had from care providers within the borough about how the council and NHS partners have supported them has been very positive. Another point that I'd actually like to highlight is around actually seeing, again, this was touched on earlier, the BCF as part of the broader integration programme for Hillingdon. And included within the report is the stated intention to actually provide the board in the future with a single integration performance report, so you're not actually getting separate reports for HHCP and the BCF, but we'll be bringing the two together. I think my final point is really concerning the future, and this links in with Kevin's presentation earlier. In terms of the future of the BCF, we understand that there is an intention that there will be a 3-year BCF plan from the start of the new financial year, and that detail will follow in the wake of the comprehensive spending review announcement in the autumn. Partners will work on options for presentation to the board at a future meeting, and may actually form part of the discussion around the future composition of the health and wellbeing strategy. I think, Chairman, if I pause there to take any questions that you or the board may have.
Thank you. It's a really, really positive report, and it is, I've said it about 15 times, but I'm still going to say it again. It is great to see residents being served by joined up working. It just cuts across so many difficult gaps that we can be left in if we don't know what we're doing. Councillor O'Brien, did you raise your hand? Please go ahead.
Thank you. And yes, it's actually a very interesting report. And I am looking at the, your 2020-2021 BCF delivery plan, and you have got quite a lot of work going on there, Gary. So when this comes back, it's going to be mammoth. So good luck to you on that one. Sorry, I think I have quite an operational head on me, and I hope you don't mind me going into the nitty-gritty, but I can see in the Better Care Plan and the COVID-19 paragraphs the working relationships with, and I note the H for All and the council have worked very closely, and we did see that. We saw that advertised. We saw how that moved forwards with our residents, etc. I'd be really interested, and whether it's Gary or I don't know, possibly Tony, with the designated home care commissioning lead and the designated nursing care home commissioning lead, those two areas and how they worked. We did hear some real horror stories in connection with hospital discharge at the very, very beginning, where, you know, people were being discharged. And I'm not talking about Hillingdon Hospital or within our local authority, but, you know, people being discharged, going straight into care homes, or being discharged and being sent home, and there was no hospital discharge as such. So I'd really like to know how that moved forward and how well that worked, bearing in mind we brought a specialist in. And also, again, how was the working relationship with regards to our brokerage team, and how that benefited and worked with you as well, please? Sorry, 2 questions, but a rather long talk there. Apologies.
Sorry, Tony, or did you want to come in, Tony, or shall I respond?
Do you want to pick up the care home bit in terms of the matron, and I'll pick up the brokerage part of it?
I mean, Councillor O'Brien, in terms of how the work with the care homes is concerned, yes, that there were some issues, I think, sort of quite early on around discharge to care homes, but that has actually been, or was certainly addressed with the support from the care home support team, and the input from the care home matrons. And I think the subsequent testing as well actually helped to improve the information available to the care homes.
Okay, so am I getting that was positive?
Yes, certainly the feedback that we're actually getting from care homes is more positive.
Yeah.
That's not to say that there haven't been incidents since then, but the overall picture is significantly more positive than it was at the start of the pandemic.
So
I hope that actually answers your question.
Yeah.
Gary, would it be helpful if I came in at that point? And just to give you some reassurance, Councillor O'Brien, so in our community services, we have we've got teams which are aligned to each of the care homes within Hillingdon, and we've always provided an enrich and support service for care homes. And in fact, whenever we look in comparison with our colleagues across North West London, Hillingdon and Ealing are exemplars in terms of the support we provide into care homes from a health perspective. About shortly into the pandemic, we launched a further enhanced offer for care homes. So we provided input and support with donning and doffing of personal protective equipment, and we also provided support to help train the trainer for testing and screening in care homes, and made sure that our frequency of contact to care homes was increased, just to make sure that we were offering that slight additional layer of support to staff who were operating in an incredibly difficult situation that was unprecedented for everyone, but certainly care homes really felt a lot of pressure. So I think, in short, I think Hillingdon has fared really well, and the care home support team within the council and ourselves and colleagues in primary care really worked together to make sure we were doing everything we could to support a really challenged sector during that period.
Thank you. Tony, would you like to make a comment, please?
Yes, thank you, Chairman. I was making a number of comments and you were ignoring me, and then I realised I was on mute, so I do apologise. But actually, Graham's picked up a part of it. Care homes for a long time has been something that we focused on, because there are a disproportionate number of incidents in terms of people attending hospital, and we know that that's been a challenge for some time. So pretty much from the beginning of the Better Care Fund some years ago, it's been a focus. But I think over the past couple of years, the work that Graham's mentioned and the work of the community matrons, etc., significantly improved that. And also, as far as the local authority is concerned, in terms of its contribution to all of that, we have, I'd venture to say, probably the most frequent communication with all of the providers in our borough than anybody else in North West London, which enabled us to be we were way ahead of the guidance in terms of providing the support at the beginning of the COVID period to all of the care homes in the borough. And in fact, we developed the methodology providing financial support to them, which we didn't actually let central government know this, but the guidance that came out then mirrored what we'd already put in place. So that was quite fortuitous. So I think overall, the care home response between us, we have care governance in the local authority, which has minute by minute sort of understanding of safeguarding incidents that take place in care homes. And I have to say, safeguarding incidents aren't necessarily about the sort of direct abuse of individuals, which it can often sort of sound like. Safeguarding is about sort of, medication breaches or a range of other things as well. So we have all of that sort of quite real time. And we have a range of quality assurance officers in the local authority who go out and attend on the same day if necessary. and all of that information is triangulated amongst partners as part of our care governance. So we have a very strong, robust approach to the care governance over care homes in the borough, I think.
Do we have any other questions or comments? If not, I ask again if we agree the recommendations of this report, which I think we do, because yes, we've got some lovely thumbs up there. Lovely. Thank you very much. And thank you for the clinical commissioning group partners who worked on this joint piece of work as well. It's excellent. Thank you very much. Thank you, Gary and Tony, for presenting that. We go on now to agenda item 11, which is the strategic. I think that's Caroline. I think that's your agenda item, please. Please correct me if I'm wrong, but I think it is.
That's fine, Chair, unless Ian wants to pick up the estates. But shall I kick off, and then if there's anything extra.
Yeah, I'll demur to you at the moment.
Apologies.
So partners will recall we tend to bring an estates update to each of the health and wellbeing boards, and obviously I suppose with the context of COVID, some of the work that had been underway had a bit of a hiatus, but actually we are moving ahead with a number of the developments that we've been putting through a planning phase over the years. So in terms of our sort of larger out of hospital developments, we have plans for what we called an out of hospital hub in North Hillingdon and also in Uxbridge and West Drayton. So those are the two that I'll just kick off with quickly. So in terms of the North Hillingdon facility, that's at the old Northwood and Pinner Cottage Hospital. And we've had some really productive dialogue with the council's planning team. There's been a lot of work undertaken between NHS Property Services, who are the owners of the facilities there, and the planning team, around how we really move forward with the development that is sympathetic to some of the requests of the local communities around maintaining some of the characteristics of that site, particularly the facade, to preserve the sort of heritage aspect of that. And I think we've come to a point where we've got a kind of an agreed design around that. So that's a really good step forward, and we are now moving forward across 3 of the work streams. So one is around the actual design of the facility, and that is working with the GP practices. So there's 2 GP practices nearby that are in sort of relatively out of date premises who would be moving into that. They're very much part of the design work. We've gone through the formal pre-app meetings with the council, and we are just working through the business case development for that as well, so that we can take it through the NHS capital governance. So at the moment, the timeline for the completion of that is during 2023, but we are moving those forward as we speak. In terms of Uxbridge and West Drayton, we had previously looked at a solution whereby we would look to rebuild on the current Uxbridge Health Centre site, which board members may know is sort of behind the Chimes shopping centre. And CNWL are the organisation that own that site. We have a large GP practice in there, one of our largest. And we've been looking over the years in partnership with CNWL at various options, and that was where we had landed. However, one of the really significant challenges for both partners in that was that we would have to have what we call a decant for the GP practice that was in there at the moment. So in the sort of development phase, we would obviously have to find somewhere else to put that GP practice, which would be a real challenge and put quite a lot of constraints around how we move that forward. In the interim, there's been a potential new option that has come to light, and there's a paper that's actually in public now. It's at our primary care board tomorrow, which is actually CNWL have now got the sort of sole tenancy of Beaufort House, which is literally opposite the other side of the road to where I am in Boundary House, and I think Graham might be sitting in it at the moment, possibly. And that's a really large facility, which actually could take both the GP practice and the other out-of-hospital services that we would want to put in there. And obviously that would completely mitigate the need for a decant, so we could that would be a far more sort of efficient use of our time and resources. So the proposal going to our primary care board tomorrow is to sort of put that forward as the preferred option, so that the system can start looking at how we plan around that. Obviously, there are currently tenants in Beaufort House, so there'll be a bit of a time lag around that. But actually, from a practicality perspective, that is a very real and practical solution to us. So that's a great step forward. And then we have been looking particularly for building capacity in Hayes and Harlington and in Useley. So those are two areas where we still know that we do need additional primary care premises, both from a population need perspective and also from a sort of the state of the current practices. So we've got two down in Hayes and Harlington at the moment. So one's the old vinyl factory, and we have some facilities put aside within that. So we are working with one of our practices now just to work through sort of heads of terms and what the options would be around the model of delivery in the old vinyl factory. So that will provide healthcare services both for obviously the new occupants of that development, but also in the surrounding area in Hayes. And the Nestle site, unfortunately, we're sort of we were moving forward on that. I think we've got a bit of a pause at the moment just around considering options, particularly for the canteen building. It is still something that I think the CCG would be interested in pursuing, but I think there are further conversations happening at the moment around what services may or may not be planned to go into the Nestle site. In terms of Useley, we were successful in attracting some improvement grant funding, and so the Useley Health Centre, which people are familiar with, again was in need of quite significant refurbishment, and that's now been completed, and so that's had a significant impact both in terms of the clinical capacity and also the sort of the public space, which prior to COVID was probably more important than it is at the moment, but the reception areas and the administration areas were quite poor and have been vastly improved. But we do still know that we need some additional space down in Useley. So again, continuing to link in with the council's planning team and look as and when applications come through as to whether there are opportunities there. So really just keeping eyes out for sort of potential solutions there. I think there was some potential development that was happening down there, but I think having had conversations with the planning team, that's probably not going to come to fruition at this point in time. And then Heathrow Villages, we have sort of been looking over a period of time to see whether we could put some health provision in the Heathrow Villages area. We did identify a site on Harmondsworth Lane, but we do just need to put some further plans in place. And as I say, unfortunately, that was one of the schemes that during COVID we haven't been able to sort of progress. But now that we've got a little bit of a pause, we'll try and get that back up and running. But obviously, we're in the face of the second wave of that. But that continues to be a priority, and as and when we can get some actual facility in there, so porta cabin or the like, then we will put some services down there as well. And then just lastly, there is the improvement grant schemes that are in place. So those are sort of NHS capital schemes that we support as a CCG for the practice to access. And we've had a number of schemes completed during 2021 and one deferred to 21-22. So that really supports practice to become compliant with legislation and also maximise clinical space. And I think there's a number of financial sort of elements set out there in terms of the 106 and the financial implications. I wasn't going to go through those in detail, but happy to take any questions on any of that.
Thank you. I don't know whether Dr. Goodman wants to add anything before I come in with a question. Do you want to say anything, Dr. Goodman?
As usual, Caroline has done a fantastic summary of the paper. So there's nothing for me to say to add to that.
Thank you. I wonder if I could just mention the North Hillingdon hub. It looks like the time is the facility finishing completion 2023. That seems to be slipping a lot, and I wonder how much more it's going to slip. It slipped from 2022 to 2023. So that would be my first observation. And also, we're all using online facilities and much more and less office space. has that been factored into your thoughts? I can hear you. I know you're using that sort of thing. Have you got an opinion on that, please, Caroline?
Yes, definitely. So it is something, I mean, there's a lot of opportunity there in terms of just looking back at the business cases and making sure that actually the facilities are fit for the models of care that we're looking to develop from a virtual perspective. So, you know, really basic things like from the outset, making sure that we've got IT considerations and bandwidth in place that can properly facilitate the online consultation. And it's also quite helpful because it potentially mitigates some of the need for the kind of requirements around clinical space. We'll always need face-to-face clinical space, so that absolutely still needs to be part of the planning assumptions and part of the process. But it is now sort of significantly less of a face-to-face sort of model of care delivery, and so that is absolutely part of that. And I echo your comments around the slippage of the time. I think once we get hopefully through the application process, we'll be able to move a bit quicker. But I think with just getting the design right and taking into consideration some of the heritage elements and the changes to the footprint has taken us a bit longer than we'd have liked.
Councillor Bianco.
Thank you, Madam Chairman. I too have considerable interest in the North Hillingdon site for a number of reasons. One, I'll declare my interest. One, my doctor's surgery is probably one of those that would move into it. Secondly, it sits in the ward I represent. So those are two good reasons. I, like Councillor Palmer, are concerned that it is slipping. And I'm only too familiar with the debacle that was the proposed new Useley Health Centre that went on for more than 7 years before we, the council, gave up on the NHS on that matter to worry about it. And I know that Nick Hurd, when he was MP, was centrally involved in this to a degree that I don't think the new MP has yet been involved. However, so I am concerned about the time slippage, and I was going to ask when you expect to put your business case forward. I'm assuming that you must know what makes a good business case and what doesn't, as far as that is concerned, and therefore whether you have a reasonable prospect of success or otherwise. So I'd be interested to know when you're expected to put it forward and how long you think it will take to obtain that consent, that approval before you can move forward. But the other question I wanted to know, have an answer to, is that the site is currently being used by the ambulance service as a base, and that is to the benefit of all the residents of North Hillingdon and probably a wider area too. What's going to become of that? Because again, I have been involved in the past in trying to find new homes for the ambulance service, which is an extraordinarily difficult task. They are very difficult to bring to the table, so having found them a home, which they're going to lose in a year's time if all goes well, or whatever the period is, I'd like to know what your proposals are around that.
So first, in terms of the business case, really we'd be looking to bring that forward. I mean, again, all going well in terms of no further pauses with pandemics, probably over the next few months into early new year, because actually all of the work is in train at the moment. So the business case, although the full business case is yet to be developed, we've got the outline components of that as part of the work that we've been doing for the pre-app and the development. So that's the timeline that we'd really be working to from an NHS perspective. I think the point around the LAS, I have to say I'm not up to speed with the specific conversations around the discussion with the ambulance service, because that tends to happen with the regional offices. So the ambulance service doesn't link in specifically to the CCG, but that's something I'll go back and find. I mean, I could try and give you an answer, but I won't be up to speed on that sufficiently. But let me go away and find out just what the proposal was around that.
Sorry, you didn't answer how long it would take, you thought, to get an answer from the to your business case proposal? You're hoping to make it in a few months' time. That seems quite a long time in itself. How long does it, when it disappears into the system, how long does it take to emerge?
Well, the business case for our plans locally would be at a North West London level. So we would have to look at what the revenue implications are. So it shouldn't be, it's not part of a significant sort of national process. It's a North West London and a London process. So it should be relatively quickly. I can't put a kind of weeks or months on it at the moment, but it shouldn't be a sort of interminable national process for the hub work. It's more of an internal system process around particularly the revenue for the primary care facility and the additional floor space there.
Any update, Caroline, would be most useful to us, I think, is what we're saying. Unless there's any other comments, Susan, sorry, Councillor O'Brien, a little bit too friendly there.
You're very welcome, Jane, Chair. That's okay. Sorry, I just want to say, Caroline, thank you for an honest report as far as I'm concerned. I like to see warts and all, so I'm really pleased with that. And what I would also like to say is I really welcome your comment under finance and efficiency in, acknowledging, as you say in it, it's simply not viable to continue trying to respond to increasing demand for services. We have to find a better fit, and this is becoming more and more apparent. So thank you very much. Any comments? Thank you.
Thank you.
Thank you. We've got a big agenda, so I think if that's okay with everyone, the board will note the progress made towards the delivery of the CCG Strategic Estates Plan, and we will move on to agenda item 12, which is the Health Watch Hillingdon update. Turkey, I think you're going to take that for us. Thank you.
Thank you, Chair. I'll be brief with this. Obviously, with COVID, the pandemic, our work dramatically changed, and so hence our report as well, where we've done basically a timeline in terms of what the kind of what we've been engaged in. And engagement is our bread and butter, really. And obviously, with the pandemic, we've not been able to participate in as many engagement activities as we would have liked. Nevertheless, you'll see in the report that we've completed at least one project with regards to partnership with Public Health Hillingdon to do with sexual and reproductive health services in Hillingdon, and made some recommendations. Our young health watchers going from strength to strength have been fantastic during this period, and you'll see again in the report the range of work they've been engaged in, and even managed to run a health fest on using Zoom and with various partners. So we're really pleased with that. And actually, what we have learned from this period with the various activities is that we were about to invest in some new updated IT, but it's changed our minds in the way we're going to embark on that investment. And we've got a plan that will go to our board next week to do with how we engage going forward, bearing in mind that the COVID situation is unlikely to change significantly in the immediate future, and how we can engage with people using the various social media tools that we've got. And in relation to that, what we've tried to do is look at different ways of getting communication and messages out to the residents of Hillingdon. And we're pleased to say that some of the strategies are working pretty well. And if you look at our page 104, where we've got the data on using Twitter and Facebook and Instagram, there's been a significant growth in terms of the Facebook engagement, and we're going to look to build on that, and hopefully we'll be able to provide a better insight to that in our next report. I'll leave it at that, unless people have got questions.
Thank you. That's very good. Thank you very much. And I'm just going to nip in and say that we thank you and your organisation for the work that you've completed during lockdown, and for the innovative way that you're responding to the needs of the residents. and it's pleasing to hear that you're looking at, you know, it was going to go in an IT way and now you're looking at something else. So out of everything bad comes something good. Are there any questions for Councillor O'Brien?
Thank you, and apologies as we move on. I get on a bit of a roll, so I'll try and keep it succinct. Again, thank you. Another honest report. You may refer me to the link, which I have not looked at, Turkey. However, I was disappointed to read in connection with the youth of health comments in the last paragraph on page 98 and the subsequent items on the top. I mean, I'm hoping that either the link will tell me, or maybe you can update us now. I mean, you know, young people really do need assistance with this type of service, and a lack of awareness, telephone service lacking, confidentiality, privacy and preservation of dignity were found to be compromised, and the fourth item about the stigma around it. That really screamed out at me. Do you have any comments here at the board, or do you want, and is all the recommendations within the report going to change my mind on these concerns?
Well, we understand that the recommendations have been acted upon in a number of cases, and we will be going back to revisit those when Kim returns back to work next week. Kim, who leads on the Young Health Watch, is on leave this week. So I haven't got an immediate update for you, but the headlines are that those recommendations have been acted upon.
Councillor Palmer, can you hear me? Because I'm not able to raise my hand. Councillor Palmer?
Sorry, Sharon, I'm committed myself to mute. Yes, I can hear you. Did you wish to comment?
Yes, it was the Kim worked with the Public Health Department to undertake the mystery shopping. Yes, we asked them to the Health Watch to do it because we wanted to ensure that the services that are being provided for young people actually do meet their needs. So we found the work that they actually undertook very valuable. They were trained last spring, and they undertook the work in spring/summer last year. And yes, Turkey is right that the London Northwest London hospitals are working on those recommendations that have been put forward, and we check on that at each of the meetings. But we would like to, but given the issue of coronavirus, it's difficult to undertake a second site visit because they're now reducing the number of face-to-face appointments. And just as a matter of interest, we also undertook a mystery shopping with older people, and that revealed even more areas of concern that we are now following up with the hospital. But the final report has not been produced as yet.
Okay, so it would be true to say that it's a work in progress, and we would hope that the concerns are dealt with, but that's something that we need to keep alive to, I suppose, because yes, it's difficult times, isn't it? In all, COVID is making a lot of things more difficult, but it is also highlighting a lot of things that have been there from the start. Councillor O'Brien, does that satisfy your answer?
Yes.
Question.
Almost. Sharon, apologies. Can I just ask, you said trained spring/summer last year. Are you saying spring/summer 2019 or the last financial year 2020?
Oh, it's 2019-20. So it took not this summer, last summer.
So this is a year ago. So we would hope that there's been significant.
Yes. Yes.
Right. Thank you. Thank you, Sharon. And thank you, Turkey.
Thank you very much, Turkey, for presenting that. I'm going to move on unless anybody has anything, but my thanks again. And that brings us on to agenda item 13, which is our Safeguarding Partnership report. Claire, are you presenting this one? I can see your face down in the bottom right-hand screen. Welcome.
Thank you. Good afternoon. Thank you, Chair. It's myself and Alex Common that are doing a joint presentation, but I shall start off. Alex and I are delighted to present the 2019-20 Safeguarding Partnership Annual Report. This is the partnership's first report under our new arrangements, and it's important to note that this is the final draft version that we've shared with you today, which is awaiting validation from the Partnership Executive Leadership Group that is meeting in late October. But clearly there is a requirement to present it to the board this afternoon. Clearly, everyone has the right to live free from abuse and neglect. And last year in the borough, there was a really sharp focus on reviewing our local safeguarding arrangements to strengthen collaborative working between children and adult safeguarding, and importantly, also with other strategic forums in the borough. And we'll all be aware of different forums that exist. This meant we had to revise how we worked and set ambitious strategic objectives to optimise the safety, well-being and quality of life of all Hillingdon residents across each and every age group. And the outcome of the work was the development of the Hillingdon Safeguarding Partnership. And I truly do believe that the development of this partnership has enabled some real changes and for our vision to become a reality. And I think that the report demonstrates this. Without going into too much detail, there was a requirement, a legislative change that prompted the changing of our children's safeguarding arrangements. And that was around the Children and Social Work Act and some statutory guidance called Working Together to Safeguard Children. These changes introduced a new safeguarding partnership where the local authority, the CCG and the police now share equal responsibility in safeguarding vulnerable children. I think we'd all agree that's exactly the position it should be. In terms of safeguarding adults, the changes for children really provided us with a real opportunity to review our local arrangements. Now, while safeguarding adults, I think it's fair to recognise, has always felt slightly behind children's, the Care Act saw us putting that on a statutory footing. And the Care Act 2014 provides the legal framework for safeguarding adult boards, but it gives us some wriggle room in how we implement our arrangements locally. So that's what we've done here in Hillingdon, and it's a real pioneer step for us. The Safeguarding Children's Partnership and the Safeguarding Adult Board essentially are the two main multi-agency forums that are responsible for safeguarding activity. And the report we're presenting to you today outlines the work for the financial year 2019-20, so last year, which can get a bit confusing for the position we're at this year. Really, the presentation of this report today is to provide the board with reassurance that our multi-agency response to safeguarding in the borough is robust and effective in optimising the safety, well-being and quality of life of all our residents. We will take the report as read and are happy to take any questions, but we feel it is important to highlight a few key areas. Now, while there are clearly distinct areas of work for children's and adults, our new safeguarding arrangements led to the establishment of some really important shared areas of work, namely our modern day slavery subgroup, our serious case panel, which is a panel that high risk cases where there may be a need for a statutory review or any other type of review are referred into, and our practice development forum. And this forum shares learning and practice improvement across children's and adults across the borough. So before I hand over to Alex, I just wanted to highlight some of the key areas for the adults report. So you will see that our main priorities for 2019-20 have carried forward into this year. And the reason for that is we spent a lot of time embedding our new arrangements, really understanding what the key areas that we wanted to work on would be. So those are financial abuse, modern day slavery and domestic abuse. Now, we recognise that the views of adults who are experiencing abuse, neglect or significant self-neglect must be central to absolutely everything we do, or would be as well not bothering, in my view. Because if we don't get it right for those adults, then we're doing something wrong. So we've also commenced an ambitious action plan around what we call making safeguarding personal. And that's essentially making the adult's views central to everything we do. We have seen an increase in safeguarding adult concerns into the local authority. They've gone up 20% compared to the year before. And we think that's a good thing because it means people are talking about safeguarding and there's an increased awareness across the borough. In 84% of the inquiries we undertook, the adult was asked what they wanted to happen. So that's really positive. Now, you may ask why only 84%. There are times where we're not able to ascertain the adult's views. That might be for a number of different reasons. It may be that the adult's deceased as well, unfortunately. 94% of the adults we asked had their outcomes fully met or partially met. So that's a really important area of achievement for us as well. I would like to draw your attention to section 6.7 of the report, which outlines, and Tony mentioned this earlier, the work of our provider risk panel and our care governance procedures. So they are very, very robust. We've worked closely with providers and that is to improve the quality of care and support delivered in the borough and prevent things escalating to a safeguarding situation. I would also like to highlight section 6.8, which is our high-performing deprivation of liberty safeguards team. And this team is well recognised nationally for the outstanding work they do to make sure the rights of residents in the borough are upheld. We're also developing a safeguarding MASH, so an adult MASH, which will complement our children's MASH. One of the areas for development in the adult safeguarding agenda is the voice of adults and lay members, and that's a key area that we are working on moving forward this financial year. So I'll hand over to Alex for the children's updates. Thank you.
Thank you very much, Claire. Hello, everybody. I think it's a really good indication of that working together that Claire was talking about. That a colleague from Adult Social Care introduced children work so well. So thank you very much, Claire. That's great. So in terms of the children safeguarding report for the year, there are quite a few contributions in the report for key partners, and I thank everyone for contributing to that. I think what we've seen this year was really the last financial year, and what was really the focus of the year, it was the introduction of the new ways of working, the new safeguarding arrangements that were introduced by the Children and Social Care Act, and that worked really well. And I think it probably started from a point of strength, of really good relationship between the partners, but the introduction of the new arrangements and the sharing of responsibility between the three key safeguarding partners really emphasize the strength of the relationship and the strength of the working together arrangements. So during the year, we focused alongside the introduction of a new way of working. We focus on working with doing some joint work around early help, doing some joint work around neglect, and doing some joint work around safeguarding children who are at risk of contextual safeguarding and exploitation. And there is detail around each of those subgroups in the report. But I would want to kind of re-emphasize what has already been mentioned about the fact that the joint groups that we identify doing this work between children and adults, and how we're looking at having a whole system approach in terms of safeguarding, in terms of identifying needs, identifying risks, and in terms of identifying joint solutions that make sense for all our residents. And the other key emphasis of the Children's Board and Adults Board is the learning element, and the learning is now through our practice development groups and through our serious case group. There are joint groups that Claire mentioned. Through these forums, we are learning from across the sector and from across the piece. So we're looking at internal learning, internal audits for various partners. We're looking at various other research or serious case reviews that are published across the land, and we extract that learning, we compare it to where we are in terms of partnership in Hillingdon, and then we're looking at implementation plans of that learning. I suppose just a few snippets in terms of children, because obviously, you would have seen the report, but just to say that one area that we're focusing as a partnership this year was the MASH service, and the MASH team are the front of the house in children's services and the children partnership, and this has been strengthened this year because by having the police child abuse investigation team, aka Kate, joining MASH. So that led to addressing one of our priorities as a partnership, that was looking at a better participation of various agencies at key strategy discussions and strategy meetings, child protection conferences, and so on and so forth. And that was further strengthened by our close work with our CNWL colleagues that led to the development of new pathways of referring issues and referring cases to them in a timely and effective way that led to their increased participation in strategy discussions and various child protection forums. The other thing that we've seen during the last year and kind of finalized towards the end of the financial year was the innovative way in which our adolescents team have started to work with teenagers who are at risk of significant harm or contextual safeguarding. I cannot overstate enough how important working together was in getting to the point where we are now in terms of working with adolescents, and how innovative and different approach this is in terms of approaching the families differently, approaching the young people differently, and looking at a different way of engagement that's based on the relationships, and is based on building trust and building that confidence in young people to be liaising with their social workers and with everyone else in their network. And as probably everyone in this meeting knows, in January of 2020 we had an Ofsted focus visit, which is our professional regulator, and the focus of that visit was working with adolescents and working with teenagers. And the letter has been published in February of this year, and it's available on Ofsted website. And it was a really very strong and very positive recognition of a new way of working that actually makes a difference to our residents, makes a difference to our young people. So that was one of the key elements that highlight the impact of multi-agency working in Hillingdon. And just kind of keeping on a theme of relationship-based practice and engagement with young people, and engagement between workers and the and professionals, I should say, and young people and families, is the participation of our looked after children in their meetings, for instance. That is something we're really precious about, because we really want to put them at the center of what goes on in their life. We have various meetings, but ultimately we are talking about their lives. So for them, it's really crucial for us to hear them. And I think you will all know, if anyone in this forum has been ever interviewed by a child, or you've been in a meeting that was chaired by a young person, they are really tough people to please, and it's rightly so, because that's what we want. So in terms of looked after review, for instance, which is obviously for our children who are looked after, every child over the age of 4, we encourage them to attend. There's various ways of attending, so they could attend through an advocate, or phone, video, or in person. And if they are kind of willing, and if they're sort of old enough, we are encourage them to be co-chairs of the meetings. And it was really good to see that out of our cohort of children looked after, over 300 of them attended their LAC reviews during the year and contributed in various ways. And that's one of kind of successes in terms of making sure that we as a partnership are held to account by our young people, which ultimately are what we're here for. I would probably. I have a few other things that I wanted to say, but I am aware of you having had a very long agenda.
At the risk of butting in, I think, you know, we do have a long agenda. It's understandable because we haven't met for a year. I know you need to go in. Please leave when you have to. I just want to say, before I open it up to questions, that I know Councillor O'Brien may want to comment on the children's side, but having attended the Walking in Our Shoes training in a previous role, it's amazing, and there's some really, really great work there. And from my adult role, the work that has gone on in dolls, I had some training the other day, sensational. That's the best training I've ever seen in years. I commend the service that did that. And I have to say that the work we do around domestic abuse and the hubs and our collaborative working with our clinical partners, our police, to keep our residents safe, we are fast becoming a borough of excellence. If I can use the word excellence and domestic abuse, I'm sure you understand what I mean, but I'm talking about our service delivery, and I'm protecting. And this report is excellence, and I'm pleased to see joined up with adult and children, because without a safe, there's always an adult and a child. Children are at risk, and generally the case is bigger and involves an adult, so it's much easier if we can have it rolled into one. Are there any questions for our report authors? I can't, I'm not looking at everybody's screen, I'm afraid. So if anybody does have a question, please yell out this late in the day. Okay, so once again, thank you so much, both of you, for presenting that report. It's excellent. So I think what we just need to do now is to, that was just an update for us so that we are aware of the strategic priorities going forward for 2021. So thank you, Alex. Thank you, Claire.
Thank you, Chair.
Thank you, Chair.
I think we can move on to agenda item, where are we? I think it's agenda item 14, unless Nikki corrects me. Agenda item 14, which is the board planner and future items. I think that's where we are. Am I right there, Nikki?
That's correct, Chairman.
Thank you. It's been a long afternoon. Just bear with me. I'm sorry. I'm flicking through my paperwork.
Page 167.
Thank you very much. Are you discussing this bit? Is this your lead?
Okay, if you like, Chairman. On page 169, we've set out the reports that we're expecting. These are generally standard reports that are put on the planner for future meetings. If there are any additional reports that need to be included, it would be useful if members could actually identify those now.
Caroline?
The only thing I wondered about, Chair, and I don't know whether it fits into one of these other updates, is whether, bearing in mind where we are, we would want to make some space on the agenda for some kind of update on the COVID response. That's the only bit that I think could be missing, unless we want to budget under.
No, I think that seems sensible to me. Councillor O'Brien, are you indicating you want to say something?
Yes, please. Thank you, Chair.
Please do.
All I wanted to say was, yes, absolutely agree with what Caroline's saying. It would be really useful in December to get a little bit of an update of where we are. And again, this may very well come out within the, obviously in my other meetings in connection with children and education. But if possible. We have had these again, lots of comments and innuendo that we're coming up to this huge when children go back to school, there will be issues where things have not been that safeguarding domestic violence and low level neglect issues will come up. I don't know if any of that feeds in via the health teams as well, but it would be useful to have some form of information on that if that is suitable for this committee.
Any other comments? Sorry, Graham, you're waving. Please go.
Yeah, I think Tony was waving before me. He looked quite agitated, so I'll let him.
I can't see everybody. Just please, Tony, I'm really sorry. I just can't see you. Please speak.
I'm used to it, Chairman. I'm used to it. Sorry, I just thought, if I may, to add that we'd discussed, sorry, that's you and I, Chairman, we discussed previously about a more regular update in relation to the hospital as a standalone. And I wonder, given the period that elapses between meetings, it is a material enough time to have an update, both in terms of improvements they're making, but also in relation to the progress that Councillor Bianco mentioned earlier about the new build.
Yes, agreed. Graham, would you like to say something?
Yeah, Chair, there are some changes to the delivery of mental health services in the borough, and that's partially as a result of a transformation programme that we're undertaking in line with the 5-year forward view and the long-term plan, and how we radically increase access into mental health services. But there's also our team and Tony's team have been working on how we separate some of the social work services away from the community mental health teams, which is driving a slightly different model of care in Hillingdon. I just wonder, would it be timely to bring an update, just so that everyone is fully aware of what we're doing and what our model is moving forward?
Of course, this board should be what we want, and if that's what's being mooted, then that's what we should have. I can't see any reasons. I'd also like to see some reporting on children, young people, and mental health wellbeing.
I think that is on the forward plan.
I think that's just dropped off, and I can't keep having it on the paperwork and not actually discussing it. It needs to be discussed. I want this board to be open and honest, and I'm not in the business of putting reports off and off and off. I need to see them coming before the board. Those of you that have worked with me before will understand that that's not going to serve any purpose. We have to have some understanding of what we're all doing around the table. So I don't want officers having to spend time chasing reports. If your report's due, it needs to come. That's. I know it's difficult times, but I'm just getting that out there. Are there any other? Does anybody else want to speak? Please do, because I can't see you all. Does that bring that to a close, Nikki, do you think?
Thank you, Chairman.
Thank you.
You'd like to move to now?
Yes, so what we're going to do now, everybody, is we're going to go on mute, please, and we're going to wait. We need to go on to part 2, but there will be a slight delay because this is in private and we need to stop recording. So I will come back and speak when we are not recording. If you could just hang on, I'd be grateful. Is that right, Nikki?
That's right. So I'll pass over to you once we've cleared and we're no longer public.
I'm obliged.